Oh, this is really exciting today. And it's also really fantastic to be able to bring a specialist who focuses on pelvic pain for men because, I mean, it's hard enough for females to find um, pain treatment, to have people understand exactly what's going on. But for men, I think it's even harder. So it's really great to talk to Dr. Susie. We met ages ago. We've stayed in touch. We talk about lots of pelvic pain problems, because it does relate still, pelvis. But she is just so inspiring, and her resources are amazing. Her experience is amazing. It's all online. She's totally with it, into the modern age. You can make online appointments and chat to Dr. Susie. And just the website has so many resources on it, even if you just want to sort of hunt around. But anyway, it's going to be a really good chat. I can't wait. So here today with Dr. Susie Gronski, and you are the fun-loving, no bullshit physio for privates and specific to men, male pelvic pain. Yes. Who's there for men? Who's there? But you're there. And the resources on your website for practitioners, for people. I just saw that video, which is really great. It captures, the morning scenario of, oh my God, there's something wrong here. What do I do? There's help.
Absolutely. Absolutely, Soula. Yeah. Help and hope.
Yes. Yeah. When we talk about male pelvic pain, what are we talking about? What sort of pain are we talking about? Is it and what is actually okay, and what is not feeling? What is the feelings of it not okay?
That's a good question, probably to start with. How do I know what's okay and what's not okay? Any pain with with sexual activity, with urination, with bowel movements, it depends, but it should never persistently hurt. So even though some of those things may pop up in our life and may be common, like for example, if you had hemorrhoid, that's painful,
Yeah.
but also goes away for most individuals. You might also have some infrequency of perhaps sometimes having some bladder irritation or a little bit of a twinge here and there within maybe the penis, depending again on what activities were performed leading up to that event, etc. So just like any other part of the body, things can get sore and they can hurt, but the persistence of those symptoms lasting longer than they should, which is generally anything greater than 3 to 6 months, for it to be categorized as far as the medical standard is 3 to 6 months of pain lingering or lasting anywhere in the abdominal and pelvic region is then shifted into the category of persistent pain, otherwise known as chronic pain. I just have a thing with that word, so I choose to steer away from chronic. You too, huh?
Yeah. Don't put it on anyone if we don't have to. Don't bring it into the space if it doesn't need to get to that space.
Exactly. So yes, the protective buffer is larger and lasting longer in some folks, and that's where, again, that's when we should really address the issues and get help. And even before that, honestly, just to mitigate some of the fear and worry when someone does experience pain in their sexual organs or in their pelvic region, because it's very distressing. That part of the body is not used to, it's a pleasurable part of our body, for most. I'm not generalizing, but for most, it brings about some pleasure and intimacy, and there's so much meaning for us when we're talking about our sexual organs and our pelvic region, and it's an area of safety too. And when that is turbulent
Yeah,
in some way, when it gets shook, shaked up in that way, then it can be very distressing.
yeah. So if there are males listening, like what are the, is it sharp pain? Like women talk about sharp pain and dull pain and burning, and we is it the same?
I would love to share. That's a great question. I would love to share my screen if that's
Yeah,
okay.
yeah, please.
So the question about, so what do men experience, right? Those that are penis owners, what do they experience? What are some of the common concerns that one would reach out to me for?
Yeah.
The most common concern is sexual pain, which might be pain with an erection, pain with ejaculation or post ejaculation. So those are the most common. The others include testicular pain, discomfort, and it could be pain anywhere in the area of which you see here in this picture, which is we call the perineum. And just to orient people here, this is the sit bones,
Yeah.
and that's the tailbone, anus, and penis. But you can see all the pelvic structures, the muscles right now. But there are much more structures here that are involved, including nerves and vasculature. So this picture is just showing us the muscles. You can also have in structures of the erectile tissue themselves, because the erectile tissue actually comes down and attaches to the bony part of the pelvis here, which is the ischiopubic ramus. So
Mm.
here's the sit bone, and these erectile tissues are actually also attaching, have attachment sites to the bone, and then the muscles overlaying on top of the erectile tissues. And so I'll share another picture just to have folks appreciate the neurovascular innervation to this to the pelvic region in men. And
This is great. Yeah, okay.
so this picture is more looks complicated, but I'm going to make it less complicated here. Same picture that you saw in the other one, just with the nerves and the vasculature here. So yellow are the nerves, and the red depicted here is the vasculature. Again, sit bone here and here, the root base of the penis, the scrotum lifted. So you can see that all of these nerves are this interconnected webbing of neural highway, neural tissue that run along bone, through connective tissue, within muscles, and then actually go within the erectile tissue itself to innervate the skin, uh, actually between the erectile tissue, and also you have branches going to the actual skin of the penis and then to the glands or the head of the penis, which is one of the branches of the pudendal nerve here, the dorsal nerve to the penis. Yeah, it's still like, yep, I know that one. Yeah. So
Mm.
and women have or those who are identified as female also have the same, you know,
Yeah,
distribution, just organized differently, and not called the dorsal nerve to the penis, but dorsal nerve to the clitoris.
yeah,
So,
sure.
and I'm going to speak from the perspective of men, of the people that I treat
Yeah,
and work with, is that the medical community doesn't know how to help these guys.
yeah,
They're often given antibiotics several rounds. Again, very conventional biomedical approaches. And there's also not an answer for them. There's not this dialogue conversation around getting to know the person. When did this start for you? What else was going on in your life? What about sexual preferences and styles? And, just being open and honest about a conversation to really get the entire person's perspective as far as their lived experience of what's going on for them. And so I feel like that's a big missing ticket for perhaps mm, preventing acute situations to being more persistent. And I think perhaps that fear, the worry, the unknown, the uncertainty, the frustration with medical care, negative experiences around that care and beyond
Yeah.
kind of snowball into that um, very dark place that many of the men that I work with find themselves in,
Because
which is completely disheartening.
yeah, the thing is because it's actually number one, it's your privates, and so people can be shy about it. And then of course so not only you've got that fear and that shyness and that maybe stigma, but you've also that's what really requires care. Then that's what really requires that warm and fuzziness that you need to open up and feel confident with your practitioner. So it's going to be hard if people are just here thrown these antibiotics, as you say, and then they go home and they're still unwell at the end of it. And that's precious time. Really, that beginning, those first few weeks and months are so important. They're critical, aren't they?
They very are. And the messages and the words that we choose to share with others, I feel that language is so important, and how we approach offering of advice and care should really be taken into account with the person-centric humanistic type of embrace, rather than just a compartmentalized part or one diagnosis or label,
Yeah,
which is often for men, Sula, incorrect, because the label is chronic prostatitis or prostatitis, when in fact it has very little to do with the prostate. I mean, the prostate is there and all these structures are interconnected, but the label itself says, well, I have something wrong with my prostate. I must have an infection. And when you have an incorrect label, what does that mean for future treatment?
yeah,
When
yeah,
you have an incorrect diagnosis or a misdiagnosis, maybe I should take that back. It's not incorrect, it's just a
yeah,
misdiagnosis of, hey, maybe the way we're treating this issue shouldn't be just prostate focused.
yeah.
Maybe there's something more here, and there often is. In 97% of cases, it has nothing to do with a prostatic infection for men.
Yeah, I relate to that so much because I got caught up in that misdiagnosis 4.5 years. Or maybe that's my experience anyway. If I said I had pituitary neuralgia, I don't think that's the whole package. I think that there's a lot more there, because
Hmm.
it's not always just that little thing, because there's fatigue, and then there's function changes, and then there's so much else that comes with it. So you find that word and it helps you with the treatment, but then all of a sudden, it's back to general again. Or does that make sense? Like it becomes hard for a person to explain what is it that's going on.
Well, absolutely, because it is, again, how you can't remove the human from the
Yeah.
experience, right? And as you're saying, I completely 100% agree. We can't simplify one's experience down to a label, because as you're saying, it's so much more, and it should be. And that all those factors shape our experiences in our body, outside of our body, our relationships, and those are very valid and need to be considered when anyone is trying to help guide and support an individual through a very challenging time.
Is that there is so much going on there, isn't there? There's so much. It's like it's not like an arm or a limb or a joint. It's there are like, isn't there like the most nerves down there where the coccyx is? So if something's gonna scream, it's gonna scream a lot, isn't it? Like there's just a million and one things to scream. So how do you figure out what's going on?
Right. And that's probably the most challenging for a lot of us, to practitioners and people experiencing pain in this region, to really get a handle on, because of the overlap and the crosstalk of so many musculoskeletal, visceral structures, vascular structures. The autonomic nervous system is here. So I pulled up another picture just to kind of show folks what I'm talking about as far as how connected this part of our body is with other structures. So not only do you have the sexual organs, but you also have, the bladder, the prostate, the rectum, the spinal column, sacrum here, the veins and the arteries, you know, all of these structures, the abdomen in the front, the hips. So, from that perspective, it has a lot of autonomic nervous system influence, right? The fight or flight or rest and digest. And I don't know if you can see this here, but the nerves that really come from all of these interwebbing of nerves here also go to and innervate structures of the penis. And then that pudendal nerve, which we saw in that last picture, is coming from another direction and innervating it from the underside, right? So a lot of interconnectivity and crosstalk here, both from musculoskeletal structures and the visceral organs, which is why it makes it even more challenging to really pinpoint a single known cause, which is to this day, there is no single known cause for chronic pelvic pain syndrome or chronic traditionally named chronic prostatitis for men. And that is what I think is the most frustrating thing for folks to accept, is that there is no single known cause. Rarely. I mean, of course, if there was an injury that we know was like a mechanical injury or a sexual activity injury, these things happen. Then we know the onset or perhaps a trigger. But it's rare that that is the case, because it could even be maybe a minor upregulated immune system, right? Maybe there was a mild bladder infection or prostate infection that just triggered this massive upregulation or protective buffer of these systems, right? And so and then genetics too, right? Like what predisposes one person, you have two people who
Yeah.
have an infection or have an injury that's very similar. One person has a treatment A, I mean both of them have a treatment that's similar, but one person gets better and doesn't have chronic pain and the other person still has chronic pain. And I don't think we don't have any of those answers as to why that happens.
Experience how frustrating to not be able to find someone who is really listening, really knows their stuff, and who give you an explanation like that as to what might be going on. I mean, if you're not getting that explanation, move on, go find another practitioner. As far as I'm concerned, that's what really they need to look for, isn't it?
Right, absolutely. And the social scripts that we, for if I simplify it to gender roles and what is expected of, from that masculine role versus the feminine, right? And I know I'm completely just acknowledging that we're not just male and female,
Of
but
course.
for the individuals that I work with who are mostly heterosexual cisgender men, that there's just this, it's a difficulty to be able to express vulnerability.
Yeah.
There's also the expectation from practitioners who are working with men, man up. Yeah, it is all in your head. Like this will go away. You just have to forget about it. You know, and they're not being heard or validated. And often very dismissed by the medical community. So I do see a lot of overlap between all genders who experience just negative experiences within the medical community about just not being affirmed, not being validated and heard. And that is probably the most frustrating when you're trying to get care, literally care, have somebody care for you,
Yeah.
care, in that sense. So
Different sexual orientations, are they afraid? Do you think they're more afraid to come and see you? Because obviously you welcome anybody into your practice. Do you think that are they more scared to come forward, do you think? I mean, there's got to be the same amount of pain really across the board. Generally people who have pain, don't have pain, whatever sex, whatever gender, those sort of percentages or experiences are going to be roughly the same. So I hope that there's no fear there, that they're not coming forward thinking, oh, I'm really going to get judged, they've already been, treated so poorly by society. Imagine if they're in fear and pain, and really just welcome them. Susie, come to Susie.
Right. And that probably goes into a bigger social topic of microaggression and oppression and marginalization of folks who are, gay, lesbian, non-binary, trans, queer, identified, and of varying, sexual orientation and sexual expression and identity. So, on top of that, that one has to experience as part of that intersectionality of their experience. Now they're dealing with an illness, a chronic illness or persistent illness that they have to kind of navigate, which as I can, I can't speak to those their experiences, but I can only imagine how challenging that is on top of, working within a society that still holds just those stigmas and oppressive beliefs and marginalization. So
So what does treatment look like for males who have all these different kinds of pains and triggers and issues, hopefully passing
I'm
by?
going to answer that question through how I work with folks, because I know that mm, how I work with people may not be how the next therapist works with individuals, because they might have a different perspective and approach, skill set and comfort level. So that segues into comfort level. So as being a female identified person who's very comfortable working with penis owners, that I have found isn't something that unfortunately men should expect across the board,
Mm,
in as far as my experience goes, because there are many, even medical, like urologists and other health professionals. What I'm noticing is that there seems to be a trend of a lack of just being able to assess sexual organs,
right, yeah.
because there again there's a discomfort of whether touching or examining those parts on another individual. Yeah, so I think there's a lot of discomfort and hesitancy. And when folks come to see me, the first thing that we do, I have 2 hours with people. So and so I understand that that also is not
Oh,
the traditional,
can I
you
come?
know,
Can I
yes,
come, please?
yes, of course, of course. So that initial session, I do have the luxury and the privilege of having 2 hours with people. And the first hour is really just tell me your story.
Yeah.
Tell me, what are your fears? What are your strengths? What are your vulnerabilities? What have you tried? What have people told you? What do you think is going on? And how has this impacted your life, your being, your sexuality, your ability to engage with the world and the world engaging back with you? I mean, I really want to know as much detail about that person and who that person is as a human being, because that's what's going to give me the information to help them resolve, or at least support and guide them on their journey. And
Yeah.
so that's the first step, is let's just get to know each other and build that trust and build that alliance. And then I do a lot of psychosexual education, a lot of pelvic health anatomy education, as far as trying to go from this perhaps funneled or narrowed biomedical view on someone's experience to a more biopsychosocial, interpersonal, contextual, very fluid and dynamic, interdependent, interconnected paradigm or framework. And so in that session, I know that sounds very complicated, so I don't mean to scare people. It's not that complex. Really, what we're saying is we're not just going to look at you as a body part and a number. What we're going to say is, hey, perhaps all these things that you've experienced in your life and how this has changed your life is how is that influencing your experience of pain, and what can we do to help reconnect, re-identify, reframe, our relationship with pain or this difficulty, which is often, oh,
But
I'm sorry.
yeah, but you also need that in order for the direction to be right, because someone who
Hmm.
is sitting in a car, for example, maybe taxi driver, someone who's a builder, someone who's a dancer, someone who's an artist, someone who's an accountant. I mean, they're all going to have a very different treatment approach, aren't they?
Absolutely, 100%. And what's important to one person is not going to be the same importance for another person. And that is goal setting, right? Like, what's important for you? What's a priority for you? How do we get you back to engaging in life again? And that might not be 100% pain free, right? We hope for that, certainly.
Of course.
And these are difficult conversations to have, but I'm also very realistic, and we manage expectations as well. Like, I get it. When I'm in pain, I want it gone. I don't want it here, and it's uncomfortable, and it's distressing. My mood changes. I'm a crabby person. I mean, all of that. So I totally resonate with. I hear you. I know you want this gone, and we're going to do our best. How else can we move forward, and still try to take care of this issue, but not kind of block out the rest of life, try to bring life in or put life back in, because then there's that sense of momentum, and hope, as far as, okay, they're baby steps, but they're moving me in the trajectory where I see that I can get back to living a life. It may not be the same life you had before pain, you know, but it still can be meaningful, and it still can be purposeful. So again, this is a deep conversation, and I might not have these conversations on the first day for certain, right? But I say that just because encompassing the psychological, the biological, the social, cultural, the interpersonal relationships and experiences of that person are really going to dictate the assessment part.
Yeah.
So again, if somebody tells me, I mean, I have such difficulty sitting, or I have a really difficult time bending forward, or I have a difficult time having an erection, it hurts so bad, those are the main things that I'm going to say, okay, show me where it hurts.
Mm.
Show me what you do, show me exactly what you're doing, and when does it cause pain, and what have you tried to make things feel better, like what have you tried, and show me that too. So it's very fluid and functional, as far as, let's just see how your body moves. Where are you protecting? Where are we fearful? Where are we anticipating pain? And then getting that person to really start to engage with their own body, and recognize, habits of body and mind and thoughts, and yeah, I just want to be as much as possible inside their mind.
Yeah, yeah, yeah.
Yeah.
You have to be if you're going to help. I mean, that's how else. It's like anything, isn't it? You've got arm pain or finger pain, and you've just got to put it out there and
Right.
look at it.
And if it's a
And just,
penis, same thing.
that's it. That's it. Yeah.
Right, right. And of course, being very mindful of everyone's experience with their own, with their own body, especially with a very intimate part of their body. And
Yeah.
I tell people, this is where, here's why I'm going to go to these parts of your body. We're mapping pain. We're also mapping areas that feel good, or at least neutral. What is your awareness of this part of your body? And also saying, and you can also just guide me and touch your own body if it's uncomfortable for me to touch those parts. How about you show me where you hurt, and show me exactly. I don't have to do that. And so there are many ways to go about an assessment, but usually there is an assessment of, a man showing me, kind of, this is where it hurts, whether in my scrotum, in my penis, that happens. And then I say, well, because we're touching parts of your body that usually respond to stimulation from touch, you may or may not experience an erection, which is completely normal, natural, and physiological. Doesn't mean that you're aroused. So I tell folks all the time, just because you have an erection doesn't mean you're aroused.
Wow, that's
You
really
can be aroused and not have an erection.
yeah.
So
But this is
you
what
know.
this is your specialty, and I think when I go to those really intimate specialists, that's what I keep saying. This is their specialty. They've seen this and done this so many times. They are the number one carer that you could find for this most intimate part. Like that is really should be a comfort. I know it's still, might be difficult, but that should be the ultimate comfort, that you come to the right person.
Right, which is why it's so important to build trust. And I should probably comment on the correlation or association in the literature as far as trauma, sexual abuse, emotional or physical, non-consensual touch, that there's a correlation with for men, higher incidence of pelvic pain
Wow.
associated with those unwanted experiences. And I think I don't think, as a clinician, as a practitioner, it is my due diligence to make sure I'm getting consent. I mean, even though there's this traditional paradigm of there's internal work, and well, I would say majority of the men that I work with, there is some aversion to doing a rectal examination, an internal examination. And just because we were taught, or we were taught to do that one way, that is not the only way, and it's not always necessary to do internal work to get better. In fact, it may actually be counterintuitive to someone's recovery.
Mm.
And so I think it's really important, for folks who are watching to let them know, if you have any hesitancy or aversion to internal work or any part of the examination process, you have an absolute right to say, I just don't feel comfortable with that right now. Or is there anything, what other options do I have
Can I show
to
you a
help me
picture?
feel better?
Get the diagrams out. Here, it hurts here, or I think it's because I remember when I was shown the diagrams, in actual fact, I couldn't point. I couldn't point to that inner inside bit, but yet, people say, oh, you can't possibly be feeling things inside there at that point. But you do. I could, show on a chart where I thought, where in my rectum or where side of this bit on the left side of it, like I could actually really pinpoint. And it
Mhm.
was also really cathartic and helpful for me to be able to put my finger on it. It felt like I was putting my finger on it. So
Absolutely, absolutely. It's pain mapping, it's body mapping. It's naming. I think that's important. Again, it's part of that therapeutic process. Like you're saying, I was able to show someone and point on this picture. That's it, like right there.
yeah.
And that in itself is very empowering too, to some degree. I think that being able to express, however, whether it's through music or through art or through Play-Doh. I have Play-Doh and markers
Oh,
in my
that's
office. I
good.
use all sorts of things to help people express their lived experience of what they're feeling in their body and where they want to be and how they want to feel. And we often do vision boarding and just all sorts of, imagery, visual imagery and visualization. And again, anything to enhance that, the neural circuits, the reorganization of the nervous system, and the dampening of that protective buffer.
Oh, professional and it's just so hard with these intimate pains and intimate function changes and appearance changes.
Hmm.
With as a female, I don't really see a lot of appearance changes, but male, that would be a huge part of the first signs of what's going on or what might be changing or hurting, or yeah, that must be fine.
Absolutely, because yeah, men's sexual organs are they're more prominent there, but they're also, men in general have for how men learn is to be sexual beings is by experimenting with their parts. But there's a lot of permission giving for men to, oh, I have an erection, there's performance with my penis performs, and that's that association early on, right? Like, hey, that's how it works. Okay.
Yeah.
And it's also very visible, right? Like performance,
From a
erect,
baby. That happens
right?
from a baby. Yeah.
Right, exactly. Whereas it's a little different for women's experiences, right? There isn't, it's definitely touch, but there isn't an actual organ that changes or grows or gets hard, and then from a partner perspective too, like there's an association and an expectation of, oh, it's hard, so you must be aroused, or if it's not, then what does that mean? And so I think for men, again, with sexual pain or pain in anywhere in this region, or actually anywhere in the body where you're just not feeling yourself, that's going to impact the sexual appetite. That's going to impact libido, arousal. It's going to impact blood flow to that organ. So erectile difficulties, difficulty having an erection, or maybe delaying in their ability to have an ejaculation, or maybe even experiencing premature ejaculation. That all may be part of the experience of which, the pain umbrella inhabits, right? So, that, again, very common. I wouldn't say that's normal, but it's common to experience because of the influence that pain has, especially particularly in this region of the body. And then the function of that organ, pressure, friction,
Yeah.
with masturbation, if that's part of somebody's sexual menu, right? That organ is used to having a certain amount of stimulation, pressure, friction, touch. So yeah, it can get pretty complicated, but the treatment or the interventions don't have to be very complex either. If somebody has a good understanding of how to, okay, let's just take this globally and calm all these systems down and get you to feel more comfortable and confident and safe in your body, then everything else will, hopefully follow suit. But yeah, appearance changes to the penis are very distressing for folks. You can have skin changes to the penis as well, blood flow changes, as I mentioned, and also sensory changes. So sensation changes, like sensitivity. It might be hypersensitive, it might be hyposensitive,
So it's not
and then also
necessarily,
curvature.
yeah, I've always thought pain, just just pain, but it's not just pain. It's changes in function. So someone may not be in pain, but want to come and see you because something's changed. Something looks
Yes.
different, feels different, doesn't work the way it used to, expected.
Hmm.
It's not necessarily pain.
Right. Exactly. Something new in the men's health world called hard flaccid. There's symptoms, and I'm very reluctant to call it a syndrome, but it's a hard flaccid because we, you
Syndrome.
know,
Syndrome.
syndromes. But but it is helpful for men to have some under, like, I'm not alone, someone else is experiencing this, and
Yeah,
it's written in forums, it's written in anecdotal literature,
very,
in case series. So it helps
very.
for having some structure around, like, okay, I'm not
I'm
alone in
normal.
this, and other guys, yeah,
I'm
I'm
normal.
normal, right,
We're always,
exactly,
we're always
exactly.
looking for normal, aren't we? That's what we're looking for. We're always looking for normal. What's normal? Even if you said that pain is normal, like everyone just, okay, I can't calm down now. Pain, it's normal. We need to hear it.
Right, but that's not what we're told.
No.
We're in a culture that really, really wants you to prevent experiencing any pain, right? Like, if you do, oh, it's terrible. Any amount is just astronomical. If I may share a story with this is my husband's story, and I have permission to share it, but he's a mechanic. He works on cars, and he had a sharp metal. Just a particle go in his eye. It was just
Oh,
like a metal shaving that went in his eye, and
this is my
it
dad.
was
This is my,
really,
he's a mechanic. This happened all the time.
Yeah, and he was able to see, but it was annoying and it was very irritating, and like he could tell there's something in his eyes. So, you know, my husband's normal fashion, he tried to get it out himself.
Oh,
Uh didn't work. He knew, he kind of was like, okay, I need to go to urgent care. And so he went, but it didn't hurt. There was no pain. It was just very annoying and irritating, and he knew he needed to get it out. But what's the interesting part about this story is that while he was there, he didn't ask for any pain medication. He didn't ask for any pain medication. He said, it doesn't hurt me. I just want you to take it out and flush it out with whatever. They were insistent, persistent to give him pain medication.
yeah.
And they wrote a prescription for him saying, "Oh, you're going to be in pain. It's going to hurt. I'm giving you this whether you want it or not." And wrote him the prescription, but he did not even ask for it and said, "I am not in any pain." What does that tell you?
Yeah, that's it. But it's ongoing, and it's gotten a lot of people in a great big mess.
It
Like
does,
if you
yes.
don't have that, I relate that to me again. I could have easily, I did try all the medications, and the the direction that I had was increase the doses as your pain comes back, because you will adjust to it. So just keep going until you find your happy place. There's no
Mm,
happy place. Like, not only are we meant to be machines, it's never meant to hurt or get us tired, or all those things. It's a terrible thing, because when it comes to, sure, you'll be able to say my finger's sore if you've got all that going on in your head, but you're never going to talk about your private parts, not
right.
with all that going on around all that
Hmm.
expectation.
But sexual health, for men, as far as sexual difficulty, erectile dysfunction, premature ejaculation, there's so much that one can do, right? And even just sexuality after cancer,
Yeah.
prostate cancer, testicular cancer, or a cancer of a partner. Maybe you're not the one that had experienced that in the treatment around that, but your partner has. And so, how do you establish your sexual voice and your sexual identity as an individual, and also as a coupleship? And how do you turn towards each other in that very intimate space? That's really what it is. And talking about, like, sex isn't always going to be great all the time. And in fact, the good enough sex model by Barry McCarthy. I mean, he's a pioneer in this, male sexuality and sexual function. But he has this approach of just the good enough sex model. Like, sex is not meant to be what it's presented to us in entertainment.
Oh,
Intimacy matters, emotional connection matters. Men get nervous when they're in a new sexual encounter, and there's performance worry around that, and that can impact sexual function, but that doesn't mean that that's a pathology. And every single man will experience at some uh, throughout their entire life some episode of erectile failure, and that is a common thing. It's just when it becomes persistent and consistent and more frequent, then it starts to become very distressing. And that's where, it does require us to start challenging as soon as possible the traditional views around male sexuality and sex and performance, and turn towards pleasure rather than performance. Have it be pleasure oriented and not performance oriented, but that's not really what the social scripts are telling us. So,
tell us about the book.
yes, my book, Pelvic Pain, The Ultimate Cock Block. And it is a guide to help men who are experiencing pain in their pelvis. It goes through the science of what we know about chronic pelvic pain syndrome in men, and the whole spiel. I talked about chronic prostatitis as being a misnomer for pelvic pain in men, and then going through a little bit of the therapeutic neuroscience, understanding the brain's role, and even a little bit about the mind and consciousness, and adding more psychologically informed strategies of just redefining what one's relationship with pain, and how can we use pain to move forward. We might get it off of our lap, screaming, and can we put it kind of to our side just for a second? It'll still be here, but can we create enough space to open up our world a little bit, because it can be very myopic. And so it is a book of hope. It's a book of taking action and challenging some of uh, the myths around pain, and also the myths around some of the treatment strategies that are traditionally used to treat pelvic pain in men, and then also obviously giving some practical strategies that they can work on at home in the book. So
Yeah, so maybe stage one for people who are a bit scared about coming out, like buy the book at least, have a read. So in there as well, are those changes. What if someone doesn't have pain, but the changes, all of that's in there as well. It doesn't have to be someone who's experiencing pain. That's great.
that's
And there's
right.
just at your website. I mean, there's so much on there for someone. And if they're worried, they can always just go new private window. So there's no tracing on their computer, and they can really just keep on. There's so much on there. It's a fantastic resource to use. And you just keep building it, of course.
Thank you. Absolutely.
Yeah.
Yeah, I have a YouTube channel that I'm building and growing, for certain, and talk about sexual health in men. I'm also a sexual counselor and educator, just graduated from a year-long program with the University of Michigan. So I am officially a Michigan trained sexual health educator and counselor, and looking to be certified through the governing body for that. So
Oh, congratulations.
yeah, it goes really hand in hand with my work, because sexual health is an important part of one's health. Physical health, mental health, spiritual health, sexual health is part of one's well-being, and asking questions around sex is important. And when you ask folks about that, they want to tell you everything, because you're interested, and you're like, oh my gosh, I could talk to you about that. I've always had that question. It's
Yeah.
like, absolutely. So it's just fun. It's another additional tool and strategy that I use in my practice, in addition to my pelvic physio hat. Now I have my sexual counseling and education hat as well. So very complementary. So yeah, resources, sex, pelvic pain, everything in between. And I just keep growing it.
Is really not. So online, I mean, I wish I had this in my first 4.5 years. Someone can make an appointment online and chat to you.
Yes, absolutely. Yep. I do consulting and coaching online. So we have 15-minute calls. We can also do consultation strategies, which we do a deep dive into the health history, sexual health history, what's going on. Let's get to know each other. And then just having several sessions after that, just to kind of pick my brain and navigate some of this roadmap. How can we best support you and guide you? So I'm your guide, I'm your support, I'm here to help. And then there's an online program that's completely do it yourself. If you're, again, that's kind of be a stepping stone to seeing someone in person. But that program has nutrition and a self-assessment using a urogenital male model assistant, as far as doing hands-on treatment techniques and exercises and
And
stretches. And
oh,
yeah.
can we clone you and make a female version? Please.
Absolutely.
And it was just so lovely to see you, chat to you, and hear all of that. I mean, I obviously know a lot about what you do, but that is really, really important. I'm glad that this sort of video resource came about, because it's just, I mean, I could never write that in a post.
I know, exactly. And I'm so really very grateful. Thank you so much for, you know, just everything that you're doing, Soula, your advocacy. I always read your blog posts, and I just like, I know you. I love you very much. Thank you for everything. Enjoy your Sunday. I appreciate you taking your time out of your Sunday to talk
Oh,
with
you,
me.
you
Thank you.
know, thank you. Well, it's your Saturday night. Go off and have a good time. Bye, darling. And love from Theo.
Bye.
He sends his love.
Oh, likewise, likewise. So much love. Bye.